Hello, everyone, and welcome back to the Manifesting Health series. I'm thrilled to have with us today Spencer Milo. He's the Director of Philanthropy and Strategic Initiatives for the Movember organization. Welcome, Spencer.
Hey, how are you, Curry?
Excellent. Thank you so much for joining us. I'm really excited about this topic and this conversation because I know quite a bit about your organization, but I want all of our readers and listeners to listen as well. So we're quite excited. Can you tell us a little bit about yourself as we get into this? Tell us about yourself and what got you into the Movember space.
Yeah, absolutely. I appreciate it. Kind of a whirlwind approach to getting here. Joined the military 2006, had a few different tours, got hurt a few different times. Finally, Big Army said, "Hey, man, no more. You got to medically retire." And so, to be honest, I lost my purpose. I was very, I mean, I was not in a good place. Met a few people, met a friend, now that is a friend, and said, "Hey, have you ever thought about serving in a different way? You can just, work for a nonprofit or something like that." So I worked for Hire Heroes USA for 4 or 5 years, helping vets get jobs, spouses get jobs, etc. And then I was approached by a gentleman by the name of Dr. Kelly, who's the guy who saved my life at Walter Reed. Built a national network of brain injury institutes for the military and said, "Hey, I want to do this for veterans and civilians." So ended up spending 7 years building out a national network of brain injury institutes, post-traumatic growth treatment facilities, and substance abuse programs for veterans, first responders. Um, Really enjoyed working with my tribe and my folks. But to be honest, like I got to a point where it was time to try and branch out to a bigger population. I've dealt with a lot of mental health issues myself, suicidal ideation at times during my struggles at worst, and just what it is to be a man sometimes where we just hide everything. And it came back to kick me in the butt. My dad passed away in May from cancer, and it's one of those things that it just hits home. And so when I saw this role for Movember, when I started looking into more of Movember, it's so much more than just a mustache campaign in November. We are the world's largest men's health nonprofit, and we've got over 1,300 programs, raised over $1 billion for men's health programs from prostate cancer, testicular cancer, mental health, suicide prevention, etc. Really anything that affects young boys, men, or in your life. And so for me, it just fit after my struggles, my family's, everyone I knew, I just said, you know what, it's time to lend my voice here. And so I got lucky, found the role, applied, and was blessed enough to be offered the role.
Well, Spencer, thank you. I want to applaud your transparency, your honesty, but also your authenticity as you're talking some very difficult conversations, and I appreciate it because one of the big things we try to do so much as a male, but as others caring for men, is recognize that talking about it is okay. Getting that group of individuals that you trust, that you can communicate with to help build that sense of purpose again is really powerful, and I appreciate that can go a long way. We're working with some of like yourself in Movember and others to help bring that awareness even more on a larger scale. So we really appreciate you and this conversation. One of the things we talked about before we got started today is one of the latest reports. You were talking about the Real Faces of Men's Health report that's been recently put out. Can we spend some time talking about that? I want you to talk about because it aligns with some of the issues you just discussed. Can we talk about that for a little while?
Yeah, absolutely. I appreciate it. Yeah, so it was released in October, and it's the United States' most comprehensive men's health report to date. It's got some really incredible findings. I won't go into every single one of them, but I'll hit a few of the highlights because I think it's something that really resonates with me personally. But I think, to be honest, any male that reads these, and a lot of women that would read these things too, will be shocked but also kind of look back through their experiences and realize, man, that makes a lot of sense. Um, I mean, one of the most interesting things is that 3 out of 5 men account for the United States premature death.
Mm.
53% of all male deaths in the US occur before 75. And so I think that is something to really think deeply about that the men in your life, no matter how you're attached to them, 53% of them will die before 75.
Wow.
And that is just it's a staggering number. And so I think that's something to me that is just really I mean, it's hard to take. My dad passed at 75. And so it's one of those where you just look back and I'm like, man, you kind of joke like, oh, they're old. They're really not.
Mm.
I mean, I'm more than halfway there already. And so it's kind of a crazy thing to think about. And suicide's the fourth leading cause of those premature deaths among US men. And men are 3.6 times more likely to die by suicide than women. And that again, that's just it's an issue no matter who and where you're looking at. But I mean, just kind of seeing that it's hard to fathom. And I think one of the other really big stat lines that we kind of came out of that's interesting to me is that 95% of men will agree that taking care of your health is a sign of self-respect. Yet 41% say that avoiding regular checkups, it's just part of being a guy.
Not
Um,
following through with the actions. That's
yeah,
one of the things we've talked about too. Yeah.
yeah. And I think that's something that like I can speak to that. Like I can't tell you how many times I don't feel well or something's not right. And I'm like, yeah, I should probably go to the doctor,
Right.
talk to my friends or whatever. And they're like, yeah, man, you gotta go. Like I'm like, yeah, I'll take care of it. Then I never do. And it's like I look back at it, and it's such a honestly, it just doesn't make much sense to me why I don't. But at the same token, given my upbringing, giving my military experience, giving just society, like I was always kind of told, hey, rub dirt on it. You're gonna be okay.
Yeah.
You know what I mean?
So
Like,
that's a pretty substantial disparity in those who acknowledge, hey, yes, we need to take better care of ourselves. We need to do better overall. We need to communicate better. We need to be more vulnerable with our healthcare, our personal, our mental, our emotional, and so forth. But that is vastly different from those who actually follow through. What do you think is the rationale behind the gap? Where do you think we are missing something here, possibly?
there's a lot of reasons for it, but I think, I'll just speak for myself. I think for me, it's if I'm out of the game, I can't take care of other people. And it's funny. So anyone that knows me, I've got a few little cheesy quote lines or toasts that I always give. And one of the things I always say is, if you can't take care of yourself, you can't take care of anybody else. Yet I might be the biggest hypocrite when it comes to that because I don't take care of myself near as much as I should.
Mhm.
And I think that's something that we as men um, typically tend to be viewed as kind of like the protector, right?
Mm.
And so for us, if I can't protect my tribe, like that's the end of the world for me. Yet at the same token, I will not go out of my way to do it. 62% of men delay seeking care for more than 6 days after symptoms begin, and 17% wait more than 6 months.
Oh, wow.
And if you think about it, as a healthcare professional yourself, how many types of diseases or ailments that if you wait 6 months can go from treatable to terminal? And so that's one of those things, right, where it's like we're really trying to have that conversation and get people to understand that by waiting, the only thing you're hurting is your ability to be who you want to other people as well. So it's nuts.
That brings up another really good point. We often talk about how you mentioned earlier about the death rates and the disparity in death rates among men, and how a lot of this can be preventable type of disease processes, but yet we delay. And 6 months even is a substantial number at almost 20% that are delaying more than 6 months. And as you mentioned, it could be something preventable, early stage, things of that, but it could be substantially more difficult to manage at that, when you wait that long. And it brings up that back to that concept of preventable care and that prevention care that annual your annual visits or whatever else it might be that is part of what you need to do to take care of yourself. It puts us in a space where it's very common, and this is men often respond to their ailment versus not prevent. And so many times, like you say, we delay and say, "Oh, it's fine, it's fine. I'm just going to keep pushing forward. A pain, oh, it's just a small pain. It's not really bothering me," and keep pushing. And before you know it, it is 6 months later, and you've got something that's far more aggressive. And so that preventative care approach is often we don't have time. It might be a sign of weakness. What if they find something that I don't want to hear about? So let me
Yeah.
avoid. So before you go down this whole cascade of rationalization, and then it can be quite detrimental. And many times it may not be anything, but you don't know that until you actually go. What are some potential resources so people, I mean, beyond just the report, what are some resources that people can engage in to be more proactive in their care, or are there resources within Movember to help people with their care in a more preventative and proactive approach?
Yeah, absolutely. As I mentioned earlier, we funded over 1,300 programs across the globe. And some of the things that we're really focused on is kind of culturally attuned approaches, peer support models, digital hubs and campaigns. Really, we're trying to meet men where they're at. I
Mm,
think that's one of these pieces now where, you know, we're not really paying attention enough to where people are in their lives, and we need to meet them where they're at. We need to try to make that easier for them, access to care, also just kind of access to resources and awareness. I mean, the crazy thing about it, what you were just talking about, Curry, is that, like, oh, well, we don't want this. 71% of men say their decision to seek care begins with their own judgment. It's not somebody else's urging.
mm,
And that's the other thing too, right? When you're thinking about it, like, I think to your point, um, looking for a resource, and that's one of the things we're really working on hard from a community level as well, is making sure people know what is out there. There are so many programs out there, and
right.
not just programs. You've got your people right next door to you, right? You've got your tribe, you've got the men in your life, you've got and a lot of times people don't realize that they have more people in their life than they think. I know what it's like to feel like you're alone, even though I never was. But when
Mm.
you're in it, you really can't pull yourself out. And I think one of the big pieces, from the preventative perspective that I always try and tell people, and I'm really working hard to tell myself this as well. I think we as human beings, especially in the United States, we go seek medical care when we're in crisis.
Mm.
We don't do anything from a maintenance perspective. And the analogy I always draw it to is if you never change the oil in your car, your engine's going to explode. Yet, if you check and fix your oil regularly, your engine's going to keep running far longer. And so for me, like especially from the mental health perspective, if you think about it, what's a typical iteration of care? 12 to 15 sessions, maybe? And in 12 to 15, I'm supposed to be able to, hey, you no longer have PTSD. You no
Mm.
longer have depression. Well, what if instead of that, we were saying, hey, look, how about we just go on a revolving basis from a maintenance perspective? That way we never get to that crisis level. And if we
Right.
do get to that crisis level, we're better prepared to support you and also to support yourself.
You mentioned a couple of times, and I appreciate that bringing that forward again. This is part of that communication piece is the tribe effect, and so that's such a powerful message. And we applaud what you're doing within Movember, but also within yourself, talking about that tribe effect of community and how we as men and we as people caring for ourselves, but we specifically as men have the ability to connect with a tribe to say it's okay. We've seen more and more of these, men's health, not just men's health clinics or so forth, but it's also these men's health groups. There's a local group where I am that every Saturday the men get together with the younger adolescent males and they're doing exercise or they're running or they might have a bike riding event. Again, it's that smaller sense of, and there's multiple, they're all over the place, but having this sense of community. And this right here is a community of talking about the health issues that need to be spoken of. So again, I do appreciate your time. In our last few seconds that we have together, what are some takeaways? What is something you want our listeners to hear to really take away and make a change in their own life?
I think what I would just say is you're not alone.
Mm,
No matter how much you may feel like you're alone, I promise you there is someone in your tribe, there is someone out there, even if you don't know them, that wants you to be around and wants to help you. Consider me one of those people. I'm always available to anybody and everybody. And I really would stress that you're not alone. And no matter how tough the situation you're in is, you're not the first person or the only person to go through this. And I guarantee you, if you put in the work and you're willing to look for help and you're willing to speak to other people to let them know maybe you do need some help, that you need a helping hand up, not a hand out, that
mm,
you can get there. And I think I would just say this, that, we're stronger together as a society and we need everybody. And I
right.
don't care who you are, what you look like, what you do, but we are stronger together. And I think that's something that Movember believes in deeply. And we're just really working hard to change the face of men's health and start the conversation.
Excellent. Thank you again. Spencer, I cannot thank you enough for your time. I really appreciate your story, but also how much Movember can be an asset to so many different people of so many different backgrounds and really help move the needle on men's health and help bring those disparities back where they should be in a much smaller area. So I appreciate it, Spencer. Thank you for your time with us. And thank you all for joining us today for another episode of Manifesting Health. See you again soon.
Thanks, great.